Hey everyone, so today I'll be doing a pretty brief lecture, but a very high yield lecture when it comes to major depressive disorder and what you'll see on your USMLE Step 1, 2, and 3 examinations. And knowing this, you will get a lot of the points, especially when it comes to psychiatry questions. So the first thing is, what is major depressive disorder? Now, on USMLE, often what they'll do is they'll start with a clinical vignette and they won't simply tell you a patient is depressed, but they'll give you a lot of clues. They'll say the patient is having increasing fatigue, the patient is having poor sleep. They might mention the patient is depressed, but they might not even say that. So they can give you a constellation of symptoms. The way you decide whether a patient has major depressive disorder or not is that they must meet 5 out of 9 of the SIGI CAPS criteria. And the SIGI CAPS is a very helpful mnemonic that helps you decide whether a patient has major depression or not. The S in SIGI CAPS, as noted here, stands for sleep. So patients who are depressed often have issues with sleep where they can be sleeping too little or too much. They can have issues with interest on their day-to-day activities. In major depressive disorder, you have something called anhedonia, where people no longer enjoy the activities that they once enjoyed. The G in SIGI CAPS stands for feelings of guilt and worthlessness. E stands for decreased energy, where patients feel fatigue all the time. C stands for issues with concentration, where patients feel like they can't concentrate on any particular activity. A refers to changes in appetite. P refers to psychomotor retardation or agitation. And S is suicidal ideation. So once again, on the USMLE, you'll get a clinical vignette where they'll say, hey, the patient is having issues with anhedonia, where they're no longer enjoying their activities. They're sleeping a lot more than they used to. They've actually lost a lot of weight, and they're not able to concentrate on day-to-day activities. And on the basis of all those, on the basis of all the clinical symptoms, you have to decide whether they meet a 5 out of 9 criteria to count as major depressive disorder. And the thing that you have to know is, along with meeting this 5 out of 9 in the SIGI CAPS criteria, patient need those symptoms to be present for at least 2 weeks to count as major depressive disorder. So once again, just remember, major depressive disorder is 5 out of 9 of the SIGI CAPS criteria, along with symptoms present for 2 or more weeks. Now, that's the diagnosis of major depressive disorder. The second really high yield thing to know is, what is the first line medication? That one is very simple. SSRIs are by far the first line medication used for major depressive disorder. Now, for patients where SSRIs are ineffective, you can try other classes of medication like SNRIs, but SSRIs are the first line of medication. And just as an example, SSRIs include things like fluoxetine, paroxetine. So it's really important to know all the medications that are part of SSRIs, because in a clinical vignette, they might tell you what is the next best step in treatment. They might not just say SSRIs, they might give you the actual medication like fluoxetine. So it's very important to be able to identify that medication. The next part I want to focus on is, what are the side effects that you have to know with regards to SSRIs? When it comes to that, there are 2 kind of major side effects that you have to remember. One is SSRIs are typically associated with weight gain. Along with that, SSRIs can also cause sexual side effects. They can cause delayed orgasms. The last very important, very high yield thing to know when it comes to major depressive disorder and STEP examinations is how long to use a particular class of medications like SSRIs. So you have a patient who comes in and you start them on SSRIs, let's just say it's been 3 weeks, and they tell you their symptoms still haven't improved. What should you do? At that point, should you transfer them to a different class of medication? The correct answer is no. So for a patient with major depressive disorder that you start on SSRIs, you want them to try to use those SSRIs for at least 4 weeks before you try a different class of medication. And this last factor is incredibly high yield and is tested very frequently on USMLE examinations. So once again, remember, adequate trial of SSRI medication is one where you try that medication, SSRI medication, for at least 4 weeks. Now at that point, if it's ineffective, then you can try a different class of medication like SNRIs. The last thing I just want to briefly touch upon is, like I mentioned, SSRIs are the first line of medication when it comes to depression. That's what vast majority of practitioners in clinical practice use, and that's what you'll frequently be tested on. But it's also important to remember there are other classes of medications like SNRIs, TCAs, TCAs in particular, you tend to get tested on quite frequently, but it's not something that's it's rarely used in clinical practice. TCAs have a variety of side effects, like they can be cardiotoxic, they can cause, they're anti-muscarinic, so they can cause hypotension. So once again, the one that's used, the class of medication that are used most frequently are the SSRIs for major depressive disorder. So while that might not be a comprehensive review for every possible question you may get asked on major depressive when it comes to USMLE, just knowing all the things that I taught you, you should be able to answer the vast majority of questions that do come your way. And that's going to be it for today.